Hi, I'm at Dr. Duku's clinic today in London because I've had some huge complications, especially to the left side of my leg. I'm hoping Dr. Duku can rectify this. He's going to remove some of the filler I have in the right side, and then he's going to even me out and correct all the complications I've had. I've had an horrendous journey. I've had to go through the NHS and have two major life-saving operations. And now I've come to Dr. Duku to finalise everything and make everything correct again for me. And hopefully this will then be the end of my journey. But then hopefully I'll be happy and everything will be sorted.
She's the one we're removing now. I do apologize, but I won't be able to use the sensitive one. You already have a small scar here. I won't be able to use that one. The one here, I can actually use, but I cannot guarantee that will stay.
Okay.
Okay?
Yeah.
So I'm removing just this area here. Normally your filler should have been here and here. Okay, this is
far too high, isn't it?
Exactly. Yeah. This is a bit too high. This is a bit too high. So you have filler here and here as well. Some of it you actually have filler most of the area. I will use an ultrasound. Another thing is you have very superficial filler here. When I will do your procedure, this will look like a lot. It already does a bit. So
yes, I'm feeling absolutely fine. There's been no pain at all. I can barely feel Dr. Duku touching me, if I'm honest. This is probably the easiest thing I've ever had done. The procedure went really well. It went really smoothly. I literally felt nothing at all. There was zero pain. I could barely feel the doctor touching me. He was so gentle. I already look so much better. And I just can't wait now for the results for when Dr. Duku puts everything right and corrects everything for me.
So what we're going to do today is we're going to start the rebuilding process. The rebuilding process will take between 2 and 3 sessions. We're going to start with the projection. There is sagginess plus the scar that we have here obviously creates fibrotic tissue and pulls the skin down as well. So we're going to start with giving a bit of support for the bum and for the skin of the bum. Can you tense your muscles for me as much as you can? So actually her muscle mass is really good, really strong. So what we want is to put a bit of volume in the upper part. You can relax. In the upper part, relax. To give a bit of support and a bit of a lift, okay? Now, at the same time, considering the fact that the infection twice in that area, what we're gonna do today is we're gonna start with a small amount, which is 100, around 150 cc total, so 75 on each side. Okay, actually it's gonna be 80 and 70, 80 on the side that needs more, 70 on the side that needs less, okay?
Okay.
Why are we doing this? I'm doing this because if there's an issue, and you have to be aware, as soon as you see an issue, redness, swelling, anything of the sorts,
Yep.
I need you to come in here directly. We don't wait for the infection to form. We don't wait for any of that. We take it out.
Okay.
Okay.
Yeah.
Now, looking at your blood tests, at your results, at everything that you've sent us from the NHS, I do not have big concerns. So I don't feel that your risk of infection is higher than the average population now. Enough time has passed, your body is healed. I don't expect us to have any problems. You still have a risk of infection because this procedure has a risk of infection. Okay?
Yeah, yeah.
So it's standard.
Yeah.
This is the main risk this procedure has. The cosmetic risk, not being satisfied with results, stuff like that, we can fix because, again, it's reversible, it's hyaluronic acid,
Yeah.
it's not permanent. What we need to make sure is that on the off chance that you get an infection again,
Yep.
we don't wait a week and a half to treat it and you end up in the hospital. You keep in contact with me, you come in, we take care of it instantly.
Okay.
But most importantly is we're gonna make sure that that doesn't happen. Me, I'm gonna do everything sterile, everything by the book. You, as with the melting, which had a lot higher risk of infection. Than
Really?
Yeah. Removing filler has a 10 times higher risk of infection than actually putting filler in.
Okay.
Okay?
And I left here. I had no swelling, I had no bruising, I had no pain. Wouldn't have thought I had anything done. And my bum, I swear to you, within less than 24 hours, my bum looked normal again. It was amazing.
Perfect. And you can see right now, your bum looks normal, looks nice,
Yeah.
looks symmetrical. So actually, my job is a lot easier now than I thought it would be. You have responded very well to the hyalase.
Yep.
So that means hyaluronic acid was used 100%.
Okay.
Okay.
Yeah.
So that's very good news. We did send to the path lab. Sometimes it takes them longer, 6 weeks, 7 weeks. We don't have the result yet, but it was hyaluronic acid. There's no doubt in my mind.
Okay. I recently had a blood test with my GP as well, and my inflammation markers were 0. So we know I know that I'm well in that form, you know,
Yeah.
because the GP told me that when I was taken into hospital in February, my infection marker was 390.
So the CRP, which is the inflammation marker, the best marker for men. Yeah. You ended up septic. Okay. So what's gonna happen is you're gonna have antibiotics for the next 7 days. You're gonna have comoxiclave. There's no point in me giving you the stronger antibiotics that you received. Okay. It's preventive. After 48 hours, if everything is fine,
Yeah.
we will probably stop the antibiotic.
Okay.
Okay. If worse comes to worse, I will need you in here. We'll start directly IV antibiotics, and we might do, but not the big incision, that you have a tiny incision and take things out.
Okay.
Okay?
Yep.
Like the same cannula that goes in, I wash out, I take everything out. Do you have any scarring from the removal on that side?
Nothing.
Exactly the same. Okay. But again, right now, your risk of infection is
low.
the same as somebody who's having the procedure the first time.
Okay.
Okay?
Yep.
So we're not really worried about that. Okay?
Yeah.
After we do this, assuming everything is fine, we're gonna do the second session in 2 weeks' time, and it's gonna be hips. Okay?
Yep.
Then, assuming everything is fine, we're gonna do a third session where we give the whole shape of the bum. We do both hips and the shape. It's very important that you'll have 2 plasters that you cannot get wet for 48 hours. Take your antibiotics on time.
Yep.
And you avoid hot baths for 7 days. Only quick showers, not even steam showers.
Okay.
Okay?
Yep.
No alcohol for 7 days. And honestly, from my point of view, that's it. Sleeping, I recommend you sleep on your front or on your sides. Don't sleep on your back.
Okay.
Okay.
Yeah.
The procedure will do it under local anesthetic. It should not be painful at all. We're doing a small amount, quantity wise, just to test everything, and yeah, that's
Okay.
it.
So that's the first side done. It wasn't painful at all. I was a little anxious because that's the side I've had the operation on. But it went smooth, there was no pain, and that side's done. I can't wait to see the results.
Turn one side. Turn the other side. Okay. Now I want you to look from the side and look. Look.
Wow. Oh my God.
And look from the back.
My God.
See the left?
Yeah.
Okay.
Oh my God.
Yeah. So, happy? Yeah. All right.
Thank you so much.
Pleasure.
Thank you.
Pleasure. Okay. Like I told you, we're gonna get where. Yeah. I told you we're gonna get there, and we are. Yeah.
I didn't think we would, even though I believed in you, I didn't think we would, and we're already getting there.
Like,
Thank you so much.
Honestly, look, it looks perfect. We just need. I don't want to risk it today. We just need a bit more,
Yeah.
and then, if this is from July, after I finish the filler, I just separate this, and you have your whole bum back.
Thank you so much.
Okay.
Thank you.
Pleasure.
Thank you.
Pleasure. Pleasure.
Thank you so much.
Pleasure.
I'm really sorry that
It's alright. It's alright. It's alright.
it's just massive. This is not cosmetic. This is not to look good. This is literally like
I know. Look,
my
this,
life.
this. Look, this is why we become doctors.
Yeah.
Okay, and this is. I'm really happy that you like it.
Love it.
I'm really happy that it's again. Melting has gone so much better, and this is. Yeah. Okay.
Thank you very much.
Pleasure.
I'm now finished. He has corrected everything that I had wrong, and he has given me my confidence back. He has made me be able to do all the things that I was able to do before I had any complications. And I'm now fit and well and the best I've ever been. I can't thank Duku enough.